I figured I'd start with a headline of what I'm going to talk to you about today. It sounds a little doom and gloom, but I think that there's a silver lining. So here's my headline. My headline is, the economy is tough, but New Hampshire is doing better than most. And the second headline is, healthcare is expensive, but we're here to help. So let's see if I could accomplish that as I go through the presentation. Okay, so what's going on in New England? First, I think everybody knows that we're in a recessionary economy. I don't think that's news to anybody. Some of the predictions that we have here, one most notably through the New England Economic Partnership, it's predicting that we're going to lose around 250,000 jobs by the middle of 2010 here in New England. That's quite high, as folks would know. But the good news, here's the silver lining, and this is what I attempted to do throughout my presentation, is New Hampshire and Vermont are expected to do better than the other New England states. So they believe it's going to be an issue, but we're not going to be as heavy hit as other states. The second important point that is noteworthy for this state, because it does impact healthcare and it impacts healthcare quite dramatically, is that we're aging faster than the United States. Now, how does that happen? People say, how can we be aging faster? We all go up a year every single year. Well, what's happening is New Hampshire policies seem to be attracting more of a Medicare population or an elderly population. I know Stephen Reno in the past has talked about the USNH and their goal to try to, the 55% initiative, to try to keep younger folks here in New Hampshire when they get college educated and staying here. Well, in healthcare, as we continue to attract more and more of the aging population, what does that mean? It means that you would expect utilization to grow. So there's two primary components of premium. One is unit cost, so what does it cost at the hospitals to deliver services and at the doctor's offices, and utilization. As you have an older population, the utilization is going to go up because as we all age, we require more healthcare services. So not necessarily bad that we're interested in having a very diverse population to include a heavy population in the elderly population, but from a healthcare perspective, that is tough on the premiums. So if you look at the screen, you'll see that we're tracking at the average age. In the US, the average age is 36.4, and in New Hampshire, it's 39.3, so slightly higher. So what does that mean in healthcare premiums? Harvard Pilgrim specifically saw an increase in premiums 9 to 11% year over year. Health insurance is a burden to employers. We understand that fully, and we understand that it's our position and our job to try to soften that burden and to try to make it easier for you. Again, good news for consumers. Here in New Hampshire, we should be very proud of our employer community. They have taken on the commitment to offer insurance to their employees and dependents of those employees. We have a higher percentage of New Hampshire employers willing to stay in that obligation. So that's something that we should be very proud of as a New Hampshire business industry. So the short story here from the local economy, insurance is going to be a burden for the employers in the state of New Hampshire, but one that we hope to help employers continue to work on in the coming time. So national activity. I know everybody's been watching the election very closely. Everybody knows President Obama. One of the things that he's been very interested in is making healthcare a centerpiece of what he does. What does that mean? In the short term, what we fully anticipate, and certainly there's been some activity that's already happened in this space, we fully expect what's called S-CHIP to be reauthorized. S-CHIP, to put it in terms for New Hampshire, is New Hampshire Healthy Kids. That is the program where children in the state of New Hampshire can get access if they can't afford insurance. So that is going to be reauthorized and potentially expanded. So one of the goals of the Obama administration, and I think something that will impact us very favorably here in New Hampshire, is expanding health insurance for children. So we have a smaller percentage of our children uninsured in this state, but no child should be without insurance, and we fully expect that Obama will make that a centerpiece of what he's doing. The big question on the table is Obama has made it clear that he's very interested in universal health care. Can the country afford it? There's enough Democrats to work on this agenda, but are there enough Republicans that you're going to get to support a universal health care program? That remains to be seen. Certainly there was a tremendous amount of energy devoted to this topic during the presidential election time and even post-election with President Obama. We do believe it'll continue to be a centerpiece, but we don't know outside of S-CHIP how quick the country is going to be able to handle in a universal access program. It will be costly. There are ways to do it potentially that can certainly be less costly than others, but it is a costly component to our country. So that remains to be seen. So how can employers and consumers bend the trend? So I really want to blend both the employer view and our view, so the people who use the healthcare system day in and day out. And this is what Harvard Pilgrim truly believes is part of the answer to the question. So I'm going to start, I'm not necessarily going to go in order, but first, people, what I hear commonly as I go out in the marketplace is people are very afraid of high deductible health plans. They're afraid that the cost for when they need care is going up. And people characterize that as a bad news story. The flip side of that is that the more that people have higher deductibles, the goal is to get people to think twice before using unnecessary services. But you have to do it right, and the health insurance industry has to do it right. What I mean by that is that we want to make sure that preventive care is still accessed. People should keep themselves healthy, and we absolutely need to make certain that in our product designs that we encourage that. So we keep low-cost sharing on those items that will help you stay well. But the deductibles, good or bad, is a way that employers, back to the first slide where New Hampshire employers are still continuing to offer health insurance, the deductibles are a way to get the premium in a position where the employers can still keep that part of their employment package. Without introducing deductibles, we talked about premiums going up 9 to 11%. If we still had that old traditional managed care where everything was a $5 copay, trust me when I tell you our trends would be in the 20% range. So part of the answer has been that employers are purchasing different types of health insurance plans. Those include deductibles, sometimes co-insurance. Good news is the country has done some things to help people feel less of a burden as they transition to these plans, and that is what you see on the second to last bullet. It's the alphabet soup. It's HRAs, HSAs, FSAs. But what that all means is health reimbursement accounts, health savings accounts, flexible spending accounts. If you are an employer in the room and you have not yet looked into what those can do for you, I would highly recommend that you do so. They're tax-sheltered ways to offset some of the deductible exposure for your employees. As consumers, if your employer is looking or offers you a health risk assessment, a health savings account, or a flexible spending account, try to learn what that would mean to you and adopt that, because it is a way for you to set aside money tax-free that can be used as you feel the pain of having a deductible when you go to the doctor, okay? So I would encourage you to learn more about that if you don't already know about it. One thing that all health plans are focusing on, I would like to say that I think Harvard Pilgrim does this best, is in the space of wellness and disease management. And I think you probably hear about this all the time, is that it's incumbent upon all of us that we keep ourselves as well as possible. And the health plan is here to try to help make that a reality. We need to give you tools as an employer, as a covered life, to keep yourself well. And that comes from fitness reimbursement down to discounts on running shoes. There's many, many things that you can think of in the wellness space. To an employer, what you should, if you're an employer and you're here representing an employer today, work with your health plan and ask, what are your disease management programs like? What are your wellness programs like? What can we partner together on? That's the big message here. You do need to partner with your health insurer. They will make some services available to you so that you can bring services to your employee base, like disease management programs or on-site wellness programs. Health carriers can often look at the data of your particular employer, determine what services would be best to bring forward to your employer, and then partner with you to make that happen. So again, what can we do? Summary, and then I'm done, is partner with your health plan. Really talk about what does it mean? What do you do for disease management? What do you do for wellness? How can we work in this together? Look at, as an employer, what's called a defined contribution. All that means is we really encourage folks to do what's called an active open enrollment. So when you go to elect your health insurance year over year, don't make it a silent open enrollment. Make people think about it. Make them fill out an application of what kind of insurance they want. That way they can make a thoughtful decision, just like you make a thoughtful decision as a consumer in any other market you do business in. Do defined contribution. What we mean by that is instead of a percentage of health insurance, so when you say we're going to offset 50% of your health insurance cost, do a fixed amount. That way, if somebody is choosing a more comprehensive plan, they have to pay more than the person who's choosing a $2,000 deductible plan. It's a way to make sure that there's transparency to the covered life in the whole healthcare space. And that's the end of my presentation. So partner with your health insurer. There's a way to make it work and to keep costs under control. Thank you very much.